If you're over 60, there's a silent challenge waiting in almost every doctor's office. It's not your blood pressure or your cholesterol. It's the way you're seen. Because whether they admit it or not, many healthcare professionals treat seniors differently, not always with malice, but through habits, assumptions, and system pressures. And those unspoken attitudes can shape your treatment, your independence, and even your life expectancy. Today, we'll pull back the curtain on 5 hard truths about how doctors really view older adults, and more importantly, how you can push back, reclaim your dignity, and demand the care you deserve. 1. Doctors often see age first, person second. It's one of the oldest biases in medicine. The number on your chart quietly overshadows everything else. Before you've described a symptom or shared your history, assumptions begin. Fatigue must be aging, joint pain, normal wear and tear, forgetfulness? Probably decline. This shortcut might help doctors manage time, but it robs seniors of proper investigation. Real illnesses can hide behind the mask of just getting older. A 72-year-old with shortness of breath, for example, might get told, "That's normal at your age." But in reality, it could be anemia, thyroid imbalance, or heart disease, all treatable if caught early. Your strategy: never describe symptoms vaguely. Instead of "I get tired easily," say, "In the past 3 weeks, I can't finish my usual 20-minute walk without stopping twice to catch my breath." Numbers, timelines, and comparisons force doctors to look beyond age and focus on your unique story. 2. Time pressures. Mean seniors. Get rushed. Most physicians today juggle heavy caseloads. With strict appointment slots, sometimes as little as 10 to 15 minutes, doctors are trained to be efficient, and that often means steering conversations quickly. Unfortunately, older patients often come in with multiple issues at once, and rather than slowing down, many providers cut corners. We'll just look at the main concern. Important details get lost, symptoms are dismissed, and underlying conditions can slip through the cracks. Your strategy: go in with a written priority list. Number your concerns and tell your doctor up front, "I know we won't cover everything today. I'd like to focus on these 2 issues first and schedule another appointment for the rest." This shows respect for their schedule, but ensures you aren't sidelined. Another powerful move? Bring an advocate, a spouse, a friend, even an adult child. A second voice in the room reduces the chances of being rushed, and it's harder for a doctor to brush off 2 people than 1. And here's where things get uncomfortable. Sometimes it's not just about rushing, it's about what doctors assume you can't do. 3. Many assume seniors struggle with complexity. From medication schedules to new technology, there's an unspoken stereotype: older adults can't handle complexity. So, what happens? Doctors oversimplify treatments, avoid advanced therapies, or choose the easy path, even when it's less effective. This means fewer options are offered. Clinical trials are rarely mentioned, and instead of being included in every decision, seniors are sometimes left with a, "Here's the simple version, just take this pill." Your strategy: break the stereotype early. At the start of the appointment, say something like, "I'm comfortable with details, and I want to hear all of my options." Use technology to your advantage. Pull out a notebook, a health app, or even your phone. Ask questions using precise language. What's the long-term impact of this treatment? How does it address the underlying cause? The more engaged you appear, the more doctors will treat you as an equal partner in decision-making. 4. Medications can be misused. Here's a difficult truth. Medication isn't always prescribed purely for medical need. Sometimes it's used as a shortcut, to calm, to sedate, or to simplify management in busy clinics or facilities. For example, a senior who's restless after surgery may be given a sedative not because of a diagnosed disorder, but because it makes them easier to manage. The danger: side effects like dizziness, confusion, or falls, problems more harmful than the original complaint. Statistics show that nearly half of adults over 65 take at least 5 prescriptions at once, a situation known as polypharmacy, and with every additional drug, the risk of dangerous interactions rises. Your strategy: treat every new prescription like a contract. Ask 3 key questions. 1. What exact condition is this for? 2. How will we know if it's working? 3. What's the plan for stopping it if it doesn't help? And once a year, request a comprehensive medication review. Pharmacists are often better than doctors at spotting overlaps, unnecessary drugs, or dangerous side effects. Before we continue, I have a quick favor to ask. If you're enjoying this video, hit that like button and make sure to subscribe. Crazy statistic, more than 93% of people watching aren't subscribed yet. It's free, takes just a second, and really helps the channel grow. If you're already subscribed, you're amazing. Thank you. Now, let's get back to it. 5. Your life may be quietly valued less. This is the hardest one to hear. Behind the curtain of healthcare economics, treatment decisions are sometimes influenced by cost-benefit formulas. The question isn't just, will this help, but is it worth it for someone this age? That means seniors may be steered toward comfort care rather than aggressive treatment, not always because of medical risk, but because of age-based calculations. Think about it. A 45-year-old and a 75-year-old with the same condition may be offered different options, not because their health is different, but because the system quietly values their years ahead differently. Your strategy: ask directly, would you recommend the same treatment if I were younger? If the answer is no, demand a clear medical reason. Seek second opinions, especially from geriatric specialists. And remember, your life has value at every age. Let's step back. These 5 truths can be unsettling. 1. Doctors often see age first, person second. 2. Seniors get rushed because of time pressure. 3. Complexity is underestimated and options withheld. 4. Medications are sometimes misused as shortcuts. 5. And behind the scenes, your life is sometimes valued less. But here's the empowering part. Awareness changes everything. When you walk into an appointment prepared, assertive, and informed, you're not just another number on the chart. You're a partner in your care. Your questions, your clarity, and your persistence force the system to treat you as an individual, not just an age group. So don't settle for, "That's normal for your age." Push back. Ask questions. Demand the same dignity and options as anyone else, because your health matters. Your years ahead matter, and your life is every bit as valuable as anyone else's. Until next time, my friends, good luck and good health.